Kate Shenny, 85, had terminal cancer. She informed her doctor she wanted assisted suicide. However, her doctor was concerned that Kate did not meet the required criteria for mental competence because of her dementia and determined that she did not have the very high capacity required to weigh options about assisted suicide. So the physician declined to authorize the lethal prescription. Mrs. S had been struggling with malignant lymphoma for 3 years. It had spread from her lymph nodes to her bones, brain, and spinal cord. She had chemo and radiation therapy, but still suffered from considerable pain and was kept under advocate control with medication. Her primary physician had offered her an extra large amount of pain medication for her. However, Mrs. S declined the offer and kept stating, "This doctor wants me to kill myself." After the law was passed down that PAS was legal, Helen had requested for one. She had a history of breast cancer and was enrolled in hospice. She had been using a wheelchair for 2 weeks and had some shortness of breath for which she used oxygen for. She had no pain, so her physician declined her request. She went to another physician and he as well declined her request because he believed that she was just depressed. So, what do all these three scenarios have in common? Yes, that's correct. PAS, also known as physician-assisted suicide. After many years of debate, the legalization of physician-assisted suicide has not stopped the conversation regarding this controversial healthcare issue. Physician-assisted suicide is defined as a physician helping a terminally ill individual end their life by prescribing a lethal dose of drugs and having the individual self-administer the drug. Nurses must follow the 7 ethical values listed in the Practice Standard of Ethics outlined by the College of Nurses of Ontario in 2009, one of which is respecting client choice. Nurses are trusted and known to respect and advocate for patient values and wishes. PAS has become more of a common choice among terminally ill clients. There have been approximately 374 medically assisted deaths in Canada since the legalization of PAS in 2016. The Supreme Court of Canada's decision to legalize PAS on June 17, 2016 has not stopped the political debates surrounding this topic. Section 14 and 24B of the Criminal Code of Canada state that no one can consent to be killed, and that anyone who aids a person to commit suicide is committing a crime. Now, there are requirements that the client must meet in order to receive PAS, which include being competent, being able to self-administer medications, and having a life expectancy of less than 6 months. Voluntary consent must be obtained over a period of 15 days, and the client must be informed of all possible options before making the decision. Brown and Russell stated that a larger majority of Canadians support PAS, although this is a controversial topic with religious individuals and healthcare providers. In regards to nurses, Edwards explains that the Canadian Nurses Association, CNA, suggests that if a nurse's moral beliefs conflict with the patient's request for PAS, then the nurse may request a different client. Nurses must continue to provide complete and competent care to the patient and remain professional in their practice until other arrangements for the client are made. Nurses are considered the stakeholders for the issue of PAS because nurses need to have suitable education in order to be prepared to help make legal and medical decisions related to patients' healthcare decisions. When discussing PAS, the patient's wishes should be respected in order for the client to receive optimal care. Ontario's approach to PAS is one that balances the rights of the client and the healthcare provider by respecting current laws and policies. In Ontario, there have been 87 medically assisted deaths, and the average age was 71. In Alberta, there have been 29 cases with a high demand of 2 to 4 requests a week with an average age of 67. The fairly new medical assistance in dying law has finally made it possible for Canadians suffering from an incurable disease to choose to end their life and to be active leaders in their plan of care. As nurses are one of the most important stakeholders, it is now possible for them to support their clients through this process. Ontario's goal is to continue to balance the rights of both the client and the healthcare provider while following the guidelines for PAS. As this ethical, political, and human rights issue has been resolved and legalized, healthcare professionals are one step closer to allowing Canadians the right to full leadership and participation in their plan of